Hi there, my name is Veer. I'm an ENT surgeon that works for the NHS and I help people with snoring and obstructive sleep apnea. So, this video is going to help you work out what to do if you've just started snoring, or your snoring has got so bad that it's annoying your bed partner, or you're worried that, oh, I think I've got obstructive sleep apnea and I need to drive to work. What do I do about this situation? So, if you're just starting out with these problems, I'm going to help you go through each and everything that with clinical evidence to say how you're going to get treated at the end. I'll start at the lower end, things you can do at home, and then later on, all the options are available on the NHS for free. If you have very loud snoring, what I mean by loud snoring is that you can hear it through a closed door, you're unlikely to only have snoring. You're more likely to have one of the other syndromes, sleep apnea, upper air resistance syndrome, all these other syndromes that are on top of snoring, that are causing the snoring. So please don't think to yourself, oh, well, I'm not tired, therefore I don't have sleep apnea, because not many people have sleep apnea and are tired. The things you should look out for, which come with time, are that you wake up with quite a dry mouth in the morning. Sometimes you go for a wee in the middle of the night. Some people believe that's because of their prostate. They're a little bit older, they think their prostate's got bigger, but actually it's a sign of sleep apnea. People sometimes get tired, they wake up with headaches, or they start dropping off to sleep when they're watching TV at the end of the day. All of these things sort of point towards obstructive sleep apnea or a sleep breathing disorder. The first thing you should think about is unblocking your nose. A lot of people think, my nose isn't blocked at all. And you can do a nose score just to prove how blocked your nose is. But a nose score is a questionnaire you can do. But the way to find out if your nose is actually blocked is if you wake up in the middle of the night, or if you wake up first thing in the morning before you get out of bed, just sniff on each side and think, actually, it does feel a little bit blocked on one side or the other. And, or you can tape your mouth and see if you can walk upstairs, if you can feel like, oh, actually, I feel like I don't feel like I can breathe very well. If you find in the morning that your mouth is very dry, these are other things that you can think to yourself, actually, I think my mouth is blocked because in the middle of the night, I have to have a little glass of water by my bedside cabinet and I have to keep drinking it because my mouth gets so dry. It's typically because you're breathing through your mouth at night. And because of that, your mouth gets quite dry and therefore you have to keep sipping water. Another way to tell is to get something called Sudafed spray or an Otrivine spray. You shouldn't use it for more than a few days at absolute max. But just as a test, you can spray this up your nose maybe 3 times in one day just to see if you feel like, actually, my nose does feel a little bit better or a lot better when I use this spray. It's not a long-term thing at all. You get this thing called rhinitis medicamentosa, and there's all sorts of problems, and you get difficulties with coming off that spray. Your nose gets slightly addicted to it. So be careful of the spray, but there are things you can do to fix it. So particularly in people who find that they benefit from a Sudafed spray, there are other sprays you can get. There are steroid sprays, and everyone thinks, oh, steroids, I don't want to take steroids. But the newer steroids are really good because they stay in your nose. They don't spread for your whole body. People worry about the side effects of taking steroids for 30 something years. As long as you use the newer sprays, not like Beconase and Betnazol and all those sorts of sprays, but the newer sprays that stay in your nose and don't spread and give you side effects elsewhere, you're perfectly happy to use those for the rest of your life. So 2 sprays, morning and night. And it doesn't work anywhere nearly as quickly as Sudafed and Otrivine, which work within 15 minutes. But these sprays slowly, over a period of about 4 to 6 weeks, slowly unblock your nose so you can breathe as well as you can with a Sudafed spray. There are technique things that you need to do with these steroid sprays. You need to make sure that you clean out your nose first with salt water. You need to spray at the right angle. Make sure you don't sniff it up as soon as you put it in there. You want it to sit in your nose for as long as possible so it sort of marinates inside your nose and works. The longer it stays in contact with your nose, the better it takes. And also, it takes an awful long time for it to work. It's not like decongestant nasal sprays like Sudafed. So give it time, have patience, because you can use this for a very long time, but you can't expect it to work straight away. It just doesn't do it that way. It's much safer and much better for your nose if you just use the steroids slowly but surely. Another way to think about it would be, well, why is my nose swelling up like this anyway? It could be that I have an allergy to something. It's quite hard to find allergies sometimes, and if we can't find an allergy, we just call it non-allergic rhinitis. It could be pollution, it could be something that we couldn't test on the skin prick test. But if you know what your allergy is, oh, I know I'm allergic to house dust mite. It happens in sort of warm, uh, clean houses in the UK. particularly with a humidity of about 60% or so. Try and bring the humidity down, and other things I talk about in my videos that are on this channel. So there are lots of things you can do, but if you have an allergy which you've identified and there is effectively a cure for that allergy, they call it desensitization or immunotherapy, all those sorts of things, then you might as well think about getting it cured rather than using the spray for the rest of your life. So there are treatments out there. Now, that's about turbinates. These are these swellings in your nose that block your nose. Your nose could be blocked because you're twisted like this. And so one side is always blocked rather than the other. It doesn't move from side to side like turbinates do, but a deviated septal, your nose pointing the wrong way, is something that actually you could either try a nasal dilator for, which is the thing that opens up your nose like this. It sits inside your nose and opens it up. So if you find if you do this and sniff, and you feel, oh, I can breathe so much better when someone does this to me, then it might be worth getting a nasal dilator. I've done a video on that as well. I think the mute is very good. And I'm thinking about making my own nasal dilator, but it just opens up your nose and stops your nose also from collapsing in. So if you looked at my nose, if you sniff in, you might notice that just around here and here, like this, it collapses in, and that may happen to your nose as well. Again, a nasal dilator would be very good for those sorts of people. If your nose is twisted like this and the nasal dilator just doesn't get air in, typically you need an operation. It's called a septoplasty to straighten up the nose and keep it nice and straight. And you need to speak to an ENT surgeon about that. Now, the next thing you should think about is when you fix your nose and your nose is working beautifully, you know it's not a nose problem anymore. Some people stop snoring straight after that, which is great. A lot of people snore with a blocked nose. But if you don't, it may be because there's something else going on, or that you're still breathing through your mouth. And that's very common. You've lived your whole life, well, most of your life, trying to breathe through your mouth because you can't breathe through your nose. And you've turned that into a habit. To rehabituate yourself to breathing through your nose is sometimes difficult for people. And so I tend to say to people, well, just wear a chin strap. It's a ridiculous looking headset that goes around your face like this and keeps your mouth closed. I'm not a great fan of mouth tape, and I've done a video on that. But if you have to use mouth tape, go ahead. But I prefer a chin strap because it keeps your chin and your mouth closed. Mouth tape lets your jaw fall back, and I can talk about that later. But if you're trying to get your mouth to close so you can rehabituate yourself to breathing through your nose again, that does help. And after about 4 to 6 weeks of wearing this thing at night, you've got used to breathing through your nose again. You don't need the chin strap anymore. I normally recommend the Knightsbridge dual strap chin strap. Um, I think they're going through some administrative problems at the moment, but make sure the chin strap goes around the front of your head like this, not going around the back like this. Those don't work very well because it pulls your jaw back and blocks your throat near the back of your tongue. So think about a chin strap or a mouth tape, something like that to keep your mouth closed. Another thing you could try to keep your mouth closed is a cervical collar, one of these soft things that go around your neck, like in American movies when someone's just had a car accident and they turn up in a soft collar to court hoping to get more money. One of those things. There are ones which are quite good for sleep apnea. And just remember, with the chin strap and also these cervical collars that bring your neck up like this and keeps your mouth closed, you should be pressing on the front of your chin, the bone part of your chin, not on the front of your neck, because it makes you feel like you can't breathe very well, but also pushes your tongue up as well and causes more snoring in some people or obstructive sleep apnea. So be a little bit careful about that. What we're trying to do is keep your mouth closed in a safe manner so that you can rehabituate yourself to breathing through your nose. And then later, you probably won't need it. The other advantage of a cervical collar is that it extends your neck slightly. Because if you imagine, or you could try this at home, if you do this and try to breathe, you'll find that breathing around this corner is ever so slightly more difficult. You're breathing around your tongue like that. But if you extend your neck like this and take a breath, it's often an awful lot easier to breathe that way. And you'll find a lot of people just seem to breathe a lot better when their neck is slightly extended. You don't want to extend too much because then your neck hurts, but just enough that it just lifts the chin up a little bit, keeps the airway straight, opens up your airway, and it can help people with snoring and obstructive sleep apnea. The next thing I think you want to think about is the position in which you're sleeping in. I've already talked about neck extension, and you see this, I should mention this really, you see this when you're doing anesthesia in people. If they're sleeping like this, their airway blocks off. if you extend their neck like this, it opens up a lot. And even children, if you watch them sleep with obstructive sleep apnea, instead of them sleeping like this, they sort of sleep in this sort of extended sort of position like that because they're desperately trying to get air in, the sword swallowing pose or something like that. But there is other things you can do about your position of sleep. If you sleep on your side, it means that your tongue isn't falling back because of gravity. Sometimes tonsils do the same thing. So if you've got big tonsils or a big tongue, for example, and you're lying on your back, your tongue can fall back and block the back of your breathing. Your tonsils can do that if they're big enough as well. Your palate also falls back as well, like this, and starts flapping when it gets close to the back wall of your throat. So all of these things cause snoring, cause sleep apnea. And it sort of feels like a lorry backing up. And when you're watching this in someone's throat, it's quite like, oh, they've got no airway at all. So what you need to do is try your best not to sleep on your back. And your partner will know this, and their partner has to roll them over again so that they can go back to sleep and you'll get better sleep and not make so much noise. Even did a trial. Well, I looked at the last 6,000, I think in 6,044 people in my clinic and found that 60.3% of people had no snoring or sleep apnea when they slept on their side. But because a lot of people roll over onto their back for lots of reasons, their arm hurts and their ear hurts, their neck hurts, their hip hurts, all these sorts of things, that causes them to lie on their back, and then their partner has to wake up because of noise and then roll them back over again. In fact, I think it was 85.7% of people were at least 20% better when they slept on their side compared to sleeping on their back. So it's important. It really does help people. And even if it only helps a little bit, well, then a little bit is probably great for your partner. And if you're worried about sleep apnea and things like that, and you want to get more refreshed, you don't want to be a bit more productive during the day, you're trying to avoid the risks of depression, high blood pressure, strokes, heart attacks, and all those sorts of things, then sleep on your side as much as you possibly can. The thing I normally suggest is to get a WoodKnows backpack. Another video will come up here, which points towards that. A WoodKnows backpack is basically a huge backpack, which you want to be as wide as possible, not just like a little tennis ball on your back. Because tennis balls and these little, like a log on the back on your back, doesn't really work. You can still sleep in a three-quarter position, and these tennis balls, typically you wake up with this very spherical bruise on your back. You want it so big, like almost like a tortoise. You physically can't lie on your back. It looks ridiculous, like a reverse pregnancy, but it means that you have to sleep on your side. And that means you don't have to employ your partner to keep rolling you over at night. You stay on your side, you get that advantage of sleeping on your side, so your tongue isn't rolling back and blocking your breathing. It's lying on its side, so it doesn't slip back. Now, you can still lie on your side and do this, and the tongue can still fall back. So an additional, if you really want to go for it in terms of position, you should try the recovery position. And what that means is, instead of sleeping on your side, sort of pointing this way on the bed, you actually sleep like this. So you're actually using gravity to pull your tongue out of the way. So if this is your tongue and you're lying on your side, there's a bit of an airway. But if you're worried about it and you want to get as much benefit from your position as possible, try and sleep on your front. And this pulls, because of gravity, pulls your tongue out the way. Also makes your palate flap forward, so you're not snoring so much. When the tongue is like this and the palate is sitting on the back of it, and you're breathing naturally through your nose, it, no one snores in that situation. You've just got to pull your well, when I say no one, there are people actually who do snore in that position. They normally have a lateral wall problem, which I'll come to later. And so do try and sleep in the recovery position if you can. It does mean sometimes getting a pillow and sleeping right on the edge, so you can do this, so you can breathe out. I've even made my own pillow, which is somewhere over there, which allows you, there's a big hole in the middle. We call it the letterbox, and you can sleep with your mouth into it. And I talked earlier about how your arm hurts and your hip hurts and things like that. My pillow is just really extended. So if you're having problems with arm pain and your arm feels numb and your hip hurts and things like that, and the WoodKnows backpack is working for you, and you think, this is really good, but I just can't stay in that position all the time because of all these aches and pains, and I can't sleep in the recovery position because the pillow's suffocating me, then my pillow might be useful for that. And there's, again, videos about my pillow if you're interested. But it's only really useful if you know that side sleeping or even recovery sleeping is really good for you, and you've tried the WoodKnows backpack or something really big to keep you sleeping on your side, but you just find it uncomfortable. It's only for those people who find side sleeping uncomfortable. The next thing I often talk about when it comes to reducing your snoring, reducing sleep apnea, are exercises for your throat. And this came about, I think, from some Brazilian speech and language therapists. And they found that doing these exercises for your tongue, for your throat, your palate, all those sorts of things seem to help people with their snoring and obstructive sleep apnea. There was one meta-analysis done some time ago which showed that 50% reduction in snoring and sleep apnea in adults, and I think 64% reduction in children. It's quite hard to test for children because they slowly get better with time anyway, particularly if their tonsils and adenoids are shrinking down with age. So it's hard to be sure about this. And different studies have come up with different statistics on how well these exercises work. But exercising the tongue and the throat, the palate, the neck muscles, the lung muscles seems to really help people with snoring obstructive sleep apnea because as you get older, we lose 3% muscle mass as every year you go on. So every year you lose 3% muscle mass. And you need to exercise to keep the muscles going so you don't look so frail later on. The muscles all sort of shrink down. We very rarely exercise our throats. Maybe we used to sing more and round the campfire or something like this. We're not all like the Waltons anymore. We just go to bed and sitting on our phones all the time. So exercising your throat with singing and things like that seems to help. We don't play as many musical instruments, I don't think. The didgeridoo, the trumpet have all been shown to improve or reduce the chances of snoring and obstructive sleep apnea. So these exercises are targeted to help you with your throat and your palate and things like that. And I've got videos on that as well. And if you really want to do this properly, you need to see a myofunctional therapist. And what they do is they help you with these exercises. In fact, I'm doing my own little spin on this soon. I found these exercises are really good and they help people. But I've done a lot of research over Christmas, and I thought to myself, actually, there's a lot more to this that I didn't really realize. And I've made a new program which will guide you through muscle activation, increasing the endurance, increasing your muscle tone, the strength of the muscles in your throat, consolidating that, and then putting you on a maintenance program. So it's basically going to be an email that goes out every day to exercise a different part of your throat and explaining why we're doing it in this certain way. It'll include the lungs, include the neck muscles, the throat, the tongue, the palate. So it's designed to help people with snoring and obstructive sleep apnea. It's not myofunctional therapy. That's a different thing altogether. This is like my airway training program I'm setting up. But more about that some other time. That will come up. But in the meantime, look at those videos. That will really help. Now, no talk about snoring and obstructive sleep apnea is complete without talking about weight. Now, if you've gained weight, then you're likely to start snoring. That happens an awful lot of time. But if you can lose the weight straight away, often the snoring just gets better again. It doesn't always work like that. If you wait too long, the snoring seems to stay with you, even though you have lost the weight. In fact, at a certain point, weight loss doesn't really cure sleep apnea at all. A lot of people think that. They think, oh, the only reason I've got the snoring and sleep apnea problems because I gained all this weight. I'm such a fool. It's all my fault. It's often not like that at all. Snoring and obstructive sleep apnea makes you gain weight. It's the other way around than what people normally think. There are actually hormones that are released that make you want to eat carbs, make you make bad decisions about your food and your diet and stuff like that. And also you're tired with obstructive sleep apnea. You can't go out and exercise and stuff like that. When you're sleep deprived, you tend to get these extra sort of sugary foods, and the body makes you gain weight because it's the body's reaction to physiological stress, like being woken up repeatedly at night and those sorts of things. The body thinks that, he's under stress, therefore he's about to undergo some sort of starvation, therefore we'll hold on to fat. That way we can protect him. The body is designed to be protective, protect you against starvation, because that's what our evolution is all about. But in the last 150, 200 years, that's not such a big problem for humans anymore. The problem is obstructive sleep apnea. We're not really designed to deal with it. So you're slowly gaining weight, making your sleep apnea worse. And the sleep apnea started the weight gain in the first place. But if you can lose the weight, that would be amazing. It does certainly help snoring and obstructive sleep apnea. Well, I think on average, it reduces your snoring and obstructive sleep apnea by about 30 to 40%, sometimes a little bit more, depending on how big you are in the first place. If you're very large, obese, morbidly obese, Losing weight in the first 10 kilos, for example, makes a massive difference. But as you get closer to your proper BMI, the closer you'll be to getting rid of the obstructive sleep apnea. People worry that it's all about fat. It's not. If you've got lots of muscle on you and very little fat, you're just as likely to have snoring and obstructive sleep apnea. If you go to those muscle gyms where everyone looks incredible with every muscle fiber seen, they will have as much sleep apnea as the next person with a high BMI purely because of fat. The sleep apnea is only thinking about the BMI. So for an Indian guy like me, I need to get my BMI to about 20. I'm having to lose probably another 8 kilos or something. It feels like a lot. But to bring like a Caucasian person, I think they need to get their AHI down to about 23. And even then, you're only getting a 30-40% improvement in your snoring and obstructive sleep apnea if you've been snoring for a very long time and gained the weight. And it will really help you, particularly in the later stages of what I'm about to talk about, surgery and things like that. Because if you're healthy, you're physiologically healthy, the weight has come off, you're much more able to cope with these operations that are later on that I'm going to talk about. The surgical success rate of these operations is much greater if you can lose the weight. It's also safer to have anesthetic and all those sorts of things. So losing weight, apart from it helping all sorts of other parts of your body, it is a good thing, but don't expect it to cure you. In fact, I think the rates are long-term weight loss with a good BMI. I think the trial talked about 40 kilos of weight. That's an awful lot of weight loss. There was only a 3% cure rate with obstructive to get rid of your obstructive sleep apnea. Some people, I think 11% of people lost all their weight, got rid of their obstructive sleep apnea initially, but even though they kept the weight off, their sleep apnea came back within a few years. So, and you'll know people out there who said, I've always snored, even when I was a skinny little rake in university. And now when I'm 40, 50-year-old and I've gained all this weight, that the weight loss is not really a thing. It will help and it's worth trying. Just be careful what you hope that it'll do. It should be used alongside all the other treatments I'm talking about. And what I say to people is, initially losing a bit of weight is quite possible, but try not to bounce back up again. What I'd say to people is lose the weight and you'll find you sort of plateau off at one point and you go, oh, this is too difficult, and then the weight will come back on. If you can hold onto that plateau stage for about 3 months, your brain sort of recalibrates itself, resets what it thinks your weight should be, and then you're stuck at that level. You know how you gain a bit of weight and lose a bit of weight in Christmas and January, which is when this video is done. You sort of come back and forth at that level. If you can bring your level down and then hold it for about 3 months, a part of your brain says, actually, this is my new weight. I'm going to stick to this weight. And we can just go up and down a little bit there. And then later, when you have the courage, the motivation, determination to do it again, you can drop again with the same sort of diet. And then you'll bounce up and down at that lower level. And it's a gradual thing. Exercise does help with weight loss, but not in the way you think. People think that if I run all day and eat what I like, I'll lose weight. It's not true. Sadly, exercise does not help you lose weight. What it does do is that once you've lost the weight with diet and calorie deficit and all those sorts of things, losing the weight, it's going to help you not gain the weight again, but it's not going to help you lose the weight. Since I've talked about the rather thorny issue about weight and weight loss and things like that, I should talk about smoking and drinking and all those other things. Smoking, unfortunately, is not great for you, and I think a lot of people know this already. Instinctively, you know this. Firstly, it blocks your nose because the little hair cells in your nose don't work very well, so your nose gets blocked up. The other thing that happens is that smoking damages your lungs, and if you're trying to get breathing in and out, and you're trying to get the best quality air coming in and out and giving you oxygen, well, then ruining your lungs with nicotine and tobacco and all those other things is not going to be a great idea. So, and also, if you've been smoking for a long time, when you stop the smoking, you'll gain the weight again. So come off the cigarettes. It's not great. If you truly care about your snoring and obstructive sleep apnea, you need to stop the smoking. Alcohol, I think most people know this already. If you drink alcohol and you go to sleep, you snore much louder. Your partner will say the same thing. And your sleep apnea will get much, much worse because alcohol makes all the muscles do that and it collapses and blocks your breathing. It also robs you of dream sleep. So if you're not getting dream sleep, you're having problems with memory retention, learning new things, just feeling like you're in a brain fog during the day. In fact, a lot of sleep apnea starts off with feeling like you've got a brain fog. You're not tired, but you just feel like you can't concentrate on things. You're trying to read a passage, you just can't get it into your head. You have to reread it again. You're not as productive as you used to be. You're making mistakes at work, all those sorts of things. So that's one of the first stages, because when we dream, what happens is that all the muscles in our body just goes limp, because we don't want to act out these dreams. You don't want to run around the house fighting dragons and things. So the body turns off all the muscles in our body so that we can dream safely. If you're dreaming and your muscles all go flaccid and then the airway blocks off, that's known as REM associated, rapid eye movement, dream sleep, REM associated sleep apnea. And sleep studies often miss it, because if you only look at the AHI, this is the number that everyone talks about with sleep apnea. It says, oh, you only stop breathing 4 point something times an hour. That's below the normal limits. There's nothing wrong with you. And you go, I feel terrible. And that's because they're not looking specifically at the dream sleep, one of the most important parts of your sleep. And if you looked at the dream sleep, oh, wow, my AHI in that level is 20, 30, but because it's only counts for about 10% of the whole night, therefore it is not registering as an important part of my overall sleep. But not all sleep is of equal quality or importance. Some bits of sleep aren't as important as, say, dream sleep. So if you're not breathing badly at that stage, who cares? I'm not going to go into that. I'm going to start ranting about different stages in sleep and when you get problems and how the AHI is rubbish. Just remember, if you're dreaming, that's one of the most important parts of your sleep. And if you're drinking alcohol, it robs you of dream sleep as well. And also in the morning, you feel terrible. You end up drinking coffee, and then you go, oh, I could just get through my day because I've had a really bad day. And at the end of the day, you've drunk so much coffee, you think, oh, I need to drink alcohol to get to sleep again. It's not a good idea. You get through this horrible vicious cycle of using drugs to get you to sleep and then wake you back up again, and it will slowly ruin your health. There are other drugs I should talk about, things like cannabis and amphetamines also. All of these drugs change the way your alertness, your ability to breathe. You don't need me to tell you all of these things. You know instinctively this is bad for you guys. So think about these things. There are situations when cannabis can be useful in certain types of sleep problems, but not for sleep apnea. So just be careful of those things. And I'll try and move on to other things now. There are things called tongue retaining devices, which is basically a bit like a suction cap. You put your tongue in them and it pulls your tongue slightly out of your mouth. They work really well because what they're doing is they're stopping the tongue from falling back and blocking your breathing. And also the tongue is attached to your palate, the dangly thing at the back of your throat. So if you're pulling your tongue forward, you're also pulling the palate forward, so you're not snoring quite as loudly. I think there was a paper that said there was about a 53% reduction in your snoring and sleep apnea when your tongue is pulled forward with one of these little devices. They cost about £5, £10, up to £20 on Amazon. I would get a few because they're very cheap, and also everyone's tongue is slightly different. And you can tell if your tongue is a problem because if you look at the edge of your tongue, you might see little indentations of your teeth. So the tongue hasn't got enough room inside your jaw. And so it's like getting pressed up against the teeth and leaving little indentations all the way around. It's called a scalloped tongue. But if you pull your tongue out like this at night, and it's pulling your tongue out, it stops it from falling back. With these little suction cap things, you don't want to force your tongue right out so it's sticking right out like this. You just want it just past the teeth. That's what these implants do that you might have heard about on the TV or me talking about them. It just brings it just to the level of the teeth. You just don't want it to fall back. So you're trying to keep your tongue slightly at the front of your mouth rather than it falling back. That's all you're hoping for. You don't want it sticking straight out like this because it just hurts. The tip of your tongue will go numb. You just want it just gently pulled forward. It works very well. It's worth trying. And the good thing about it doesn't hurt your jaw and other things, because the next thing I'll talk about is a mandibular advancement device. It's like a gum shield, up and bottom, which so advances your jaw forward. I've done a video on that as well. I would steer away from the boil in the bag over Amazon type things that you have to sort of warm up and then put your bite down on it and make an impression that way. They tend not to fit very well. If you can get one to fit for you and it works for you, great. But they tend to be quite bulky and makes you feel like you're going to gag and things like that. They're not very useful. Whereas if you get a properly dentist designed one, they work incredibly well. They hold onto your teeth really well, so they don't just fall apart in the middle of the night. And you can calibrate them properly, so your teeth can come forward. They're very thin, so it's like a bit like Invisalign, if you've seen those sorts of people. It just brings your jaw forward without it being too bulky inside your mouth. And it's a lot more comfortable. There's even pressure throughout your teeth, so you don't feel like your teeth are loose in the morning. Your dentist will help you to make sure that you're not going to damage your jaw because you're bringing your jaw joint, you're bringing your jaw forward. It can put pressure on your jaw joint, and they'll give you something called a reliner. So that means you've worn this thing all night. You brought your jaw forward. You've stopped the snoring of sleep apnea because you're bringing your jaw forward and your tongue forward and your palate forward. Helps sleep apnea, helps snoring. But in the morning, you feel like your jaw's out of place. A rear liner just puts it back into place. And good dentists will tell you all about these things. So look at that video if you want to know more about a mandibular advancement device. Some people use the tongue retaining device, the suction cap, before a mandibular advancement device just to see if it will be useful for them or not. So it's worth thinking about that. Another option for tongue problems is a iNAP device, and a couple of videos there about that as well. It's almost like the exact opposite of the mask that blows air in, called CPAP. In this device, you're sucking air out of your mouth. It's interesting. You think, well, how's that going to work? You're pulling air out of my lungs? It's not quite like that. So, if you've got this little tubing or straw that goes into your mouth and it's sucking air out of your mouth, say these are your teeth and your tongue's like this, the straw's coming into your mouth like this. The vacuum that's being created here eventually gets your tongue to roll forward like this and block off. So there's like a suction thing and the tongue blocks off your mouth. So it's not sucking air constantly out of your lungs. There's a vacuum that pulls the tongue forward and keeps it out of the way. And also, the palate gets sucked like this so that air comes through your nose. Your mouth is completely sealed at this point, so you must be able to breathe through your nose. That's why I talked about unblocking your nose right at the start of this. But using this iNAP device, which is quite expensive, but in some countries you're allowed to rent this thing. It's a little suction device that slowly pulls your tongue forward and works really well in certain people who know how to use it properly. Again, you just want it to bring your tongue forward and hold it there. If you've got a blocked nose, it won't work. You'll just go like this, open your mouth, and it'll break the seal, and in the end, you'll just end up pulling it out. There are other devices that may be worth talking about, but I haven't seen much clinical evidence for many of them at the moment. So I'll talk about them as the evidence comes through, but those are the ones that have clinical evidence associated with them. At this point, if you've done all these things and you're still snoring, you're still having obstructive sleep apnea, it may be worth seeing your family doctor, your GP, and saying, look, I've got this problem. I've tried all of these things. It's not really working for me, or I can't lose the weight, or some other issue. Then it might be worth seeing someone on the NHS, free on the NHS, that will help you with your snoring and obstructive sleep apnea. In the old days, before the new guidance came out, we used to just, do an Epworth score to see how tired you are. Oh, you're not tired, you don't have problems, you just snore, just go home and do something else. That's not true. We know now that Epworth score, the tiredness scale, is not a good way of working out whether or not someone has sleep apnea or not. Use the STOPBANG questionnaire, which is 8 questions, and it'll tell you what's your chances of obstructive sleep apnea. In fact, I'll put a link in the video description below, which has an online link to all these questionnaires that I have available for free. And you can click on that and it will give you a printout, which you can show your family doctor or your GP to show that actually, yes, I do have a problem with my nose, with insomnia, all these other things. And, what tells you your chances of having obstructive sleep apnea based on these questionnaires. And so if the first thing that often happens is that you'll need a sleep study, a machine that you wear at night, and it monitors your breathing, monitors your oxygen levels and things like that, and tells you how loud your snoring is, tells you if you have obstructive sleep apnea or not. And from that, it can work out, these are the things that you can try. In this country, the new guidelines have come out, the new NICE guidelines, and they say that you'll end up coming into hospital, seeing a doctor, and the guidelines say that that doctor needs to look inside your nose to see if your nose is blocked, look inside your mouth to see if you've got big tonsils. And if you don't have either of those, you unblocked your nose and you don't have big tonsils, then there are 2 options generally that we normally go for. And they will talk about weight loss and things like that, which I've already talked about. But they give you either, if you're moderate to severe sleep apnea, they give you a mask, which is called a CPAP mask, and that blows air in and keeps your throat and your airways open to allow you to breathe at night, which is up till recently, the most common thing that we provide on the NHS, and it probably still is as well. The other thing is the mandibular advancement device, which I've just talked about. And if you're able to use the CPAP mask, it is fantastic. The risks are really low. The success rate's really nice because it works almost within the first night. If you can wear this thing, pumping air in, it works beautifully well. And I don't think you should be scared of this thing. An awful lot of people, particularly my patients, say, look, I don't want to use CPAP. I don't like the idea of this thing going on my face. Sometimes when you wear it anyway, so look, I'm just encouraging you to try it. And when they try it, they go, "Oh my God, I feel so good. I can't believe I've wasted all those years worrying about it. It feels fantastic. And I don't feel so tired. I feel like I can drive without worrying about crashing and all those sorts of things." So actually, I'm just going to carry on using it. I know you said you could do surgery and things like that, but I'm happy with this. I'll stick with it. And uh, yeah, about 20% of people when they first put it on love it, and they will never let you take it away from them, which is fantastic. I mean, means I don't have to operate or do anything else for these people because they feel better, the weight falls off, they feel physiologically healthier, everything seems to get better. There are a lot of people who use it and go, "Oh my God, this is hard work." And it takes certain number of weeks and help and things like that to get them to use it. About 50% of people find it hard. And in those situations, I would go to a forum like the Facebook forum, Hope to Sleep Charity. They're really good because they've got a lot of supportive members in that group, and they will say, "Oh, the reason why you're doing this is because of this. Why don't you try this? Why don't you get a warmer? Why don't you use a humidifier? Why don't you try sleeping on your side?" All these little things. And it's a very nice, supportive team that help you, and the whole community gets together. And if you ask questions, they don't get annoyed with you and say, "Oh, just look at the previous post." They're just nice people. And I really recommend you join a forum similar to that. Another thing you can think about, particularly if you like data and you really want to get in there and really understand what's going on with your breathing. There's something called OSCA or Sleep HQ, and these are things that will, rather than just getting a smiley face from your CPAP machine in the morning, so well, what does that mean? How good am I? I don't feel that great. And rather than just getting a very sort of boring sort of statistic saying you did well or you did badly, you can get these little programs which will give you all the data you need to explain how your breathing's going, what to change, what to titrate. And those things can really help you understand your breathing better. And there are people out there. If you look at Uncle Nick from Australia and Lanky Lefty 27 on YouTube. All of these guys really put a lot of effort into helping people change the settings on your CPAP. So don't, in the old days, what we used to do is sort of the respiratory teams used to say, "Here's your CPAP. There's no other choice. If you don't use it, we're going to take away your driver's license," or something awful like that. Hopefully, no one's doing that anymore. But if you're in this situation where you're wearing this thing and you're finding it difficult and you find it hard to get hold of the NHS doctor to help you with the settings, look at these YouTube channels and these websites. They will help you tinker with it and get it better so that actually, yes, I can use this better. And the other thing to think about is that even if you want surgery or some other thing, you should use the CPAP even as a bridging therapy. And also remember that if you wanted an operation, well, then nothing is going to heal very well if no oxygen is going around your body. So wear the CPAP to get you fit enough for the operation so the surgical success rate is high, the risk of complication is low. Wear it during the recovery, because if I've made a wound inside your throat and two muscles have been attached together or something like that, and the skin's been stitched up, how's it going to heal if no oxygen is getting to it? So what you should do is keep using the CPAP, wait till you've recovered, and when your surgeon says to you, actually, let's see what happens, you come off the CPAP, you do a sleep study, that other thing that monitors your breathing, like we talked about before, and see if you're see how much your AHI, your sleep apnea, has been improved by. You go, well done, your sleep apnea is reduced by 50%, and you still need your CPAP, but we got the next operation now to bring you down even further. Or you go, well, amazing, you've come down below 15 now. You don't need your CPAP anymore. You still may have sleep apnea, but there are these 2 or 3 operations that will bring you down even further. I'll say this now, there is no one operation which will fix all your sleep apnea. I don't think you should think about surgery as a easy, quick method that will solve all your problems. I don't want the mask. I'll just get an operation, get it sorted. I'll be fine in a week or so. It doesn't work like that. I know I'm a surgeon with these obstructive sleep apnea patients. Having one operation which will solve your menopause problems, your all your weight gain, your thyroid problems, your insomnia, and also the multiple problems in your throat, one operation isn't going to fix all that. I tend to think of it as a process. I tend to do, say, remove your tonsils. That's the biggest problem there. It'll give you biggest sort of bang for buck or something like that with the NHS. We bring you down. Your sleep apnea does get better, but it doesn't. It's not a 100% success rate. Maybe improves you, shall we say, 40%, and you feel better. The CPAP is working better. There's not so much pressure against you, and you've lost some weight. You feel better. You're more able, more healthy, more physiologically active now to be able to cope with the next operation and then the next operation until we get you down to an HI of less than 5, until you're breathing better and we're dealing with your menopause problems, we're dealing with your insomnia, all these other things, the depression that can come on with obstructive sleep apnea. So it's a process. It's not a magic bullet. There's no such thing. So please don't think of surgery as an easy way out. It really isn't. I should talk about surgery now. I am the surgeon here. So the way I work out how or which operation to do for you, I can't use the sleep study. The sleep study is useful because I know how bad you are, but I don't know where in your throat I need to operate on. Because I have about 43 different operations I do for snoring and obstructive sleep apnea, I need to know where to operate on. So what I do is I get people to lie down in a bed in hospital, injection in the arm, we inject a little bit of sedation, and I talk about my particular technique, which I think is slightly more representative of this, of sleep. And you get people to fall asleep in front of you. So they're snoring away in front of you. They're sleeping there, and you think, okay, now they're snoring away, and they're snoring away just as well as the sleep study. This is what they do normally at home. And with a little fine camera, I look at the back of their throat and I can videotape the inside of someone's throat to see which tissues are sort of flapping around, generating the noise, and which tissues are collapsing in, blocking your breathing. And when you know that, when you know the different parts of your throat which are causing obstruction, causing flutter, snoring, all those sorts of things, then you just wake the patient up and go, guess what? Watch this video with me. And you explain everything. So look, this is what's going on. And when you see it, it makes much more sense. And when you can know who your enemy is, then you can work out, you've made a diagnosis, then you can work out what the treatment is, and then you can work out what the prognosis is. Some things are easy, like if the only problem you have is big tonsils, then take your tonsils out. In fact, our national guidelines, which is why we look in people's throats and look up people's noses before we give CPAP and things like that, is that if you're a relatively slim person with big tonsils, you shouldn't have CPAP. You should have your tonsils out first, because an awful lot of time your sleep apnea is cured by removing your tonsils. And there's lots of studies that show this. And that guidance has been in our country for several years now. So hopefully most centers are now moved across from just giving everyone a CPAP device. Sleep centers should now be examining everyone. And tonsils are an easy first step. But there are lots of different operations. As I said, there's lots of things. There's palate operations, there's side wall operations, because the side wall of your throat can collapse in like this. So normally people snore like this. Some people snore and block their breathing like this. So the side wall of their throat, left and right, come together and rub together. That's interesting. And there's operations that brings it open like that, a bit like a throat lift or a facelift. And then remember I said that your tongue keeps falling back and blocking your breathing. That can also be an issue as well. There are operations to shrink down extra tissue sitting on the back of your tongue. So if you had big tonsils as a child, you may have a big tonsil sitting on the back of your tongue. So there's operations to shrink that down. Sometimes, if it's not anything to do with that and your tongue is your main problem, you're going further up the ladder of things I do. I think there are, I can't remember how many operations I do for the tongue, but you might get to the point where you go, look, I'm really sorry. There are three main operations now. There's a robotic operation, which we remove some of the muscles of your tongue. You think, oh God, that sounds a bit hairy. Some people end up having an operation called an MMA operation or BiMax procedure, where they break the bones across here, and bring the whole face forward. In some people, that would be perfect because they've got a very small chin or a small maxilla, this area here, and bringing the whole face forward sorts out their teeth problems and their swallowing problems, as well as cosmetically improving them. But it also fixes the obstructive sleep apnea to a certain degree, around about 68 to 70% improvement in your snoring and obstructive sleep apnea, which is massive. Slightly more newer options now are implants, we call them. So there's an implant here called the Inspire implant. Looks like a pacemaker. It sits underneath your skin here. So there's a little cut there. It gets put there. There's two wires that go from it. One wire goes to just sitting on top of your lung, and it monitors when you're taking the breath in. So it knows when you're trying to take a deep breath in. So you turn this thing on with a remote control. I mean, I think in America they've got apps because they're far more technologically advanced than they've all got smartphones or something. But we have a remote control. And you turn this on at night and press this. It turns on this little machine. And so that wire starts sensing when you're breathing. And then there's another wire that comes off here, goes up here to the nerve to your tongue. And what that does is it stimulates that nerve, stimulates, therefore, the tongue to move forward out of the way. So instead of your tongue falling back and blocking your breathing, it actually gets pulled forward out of the way so you can breathe behind it if you've got mainly a tongue-based problem. A slightly newer implant on top of that is this Genio implant. It's like a chip. And what that does is it sits in your chin. So make a little cut here, and it gets put right on top of the nerves, left and right this time, and it brings your tongue forward symmetrically. And this sits inside there all the time, underneath the skin, and you need to power it with something. You stick this on at night, and it charges it each night. So there are lots of new implants coming out. In fact, there's a new implant that I'm working on with this team called Restera, and there's videos about that as well, where we inject the implant into people's necks and then it gets powered externally again. So it's not a big operation. You can do it under local anesthetic is the plan. In fact, although I'm not allowed to tell you about any of this stuff, I'm seeing a person soon about making a whole new different type of implant. And a friend of mine and I are trying to put together an implant which isn't really an implant at all, completely top secret. I can't tell you about that either. So there's all sorts of things out there that are the new innovations, new things we can do to help you with your snoring and obstructive sleep apnea. And some people out there will go, no way, I'm having one of these implants inside me, which is great. Use one of the other things that I've talked about in this video. But I want to be able to say to you, there are so many different options out there. If you're the type of person who's so scared of wearing a mask at night and you don't want to go and see your doctor purely because you're worried you're going to get given a mask, please don't be scared about it. Some people end up loving it, even though they've just tried it. You don't have to wear a big mask like that. Sometimes there are little masks that just go around there, just up your nose like this. So that may be much nicer for you. And sometimes you just go, well, can't cope with this thing at all. That's fine. There are so many different options out there. All the operations I do, mandibular advancement devices, all these things you can do at home before you start on this journey to get your snoring or sleep apnea sorted out. What I really don't want is for people out there going, I know I've got snoring and obstructive sleep apnea. I'm too scared to go in and get it checked out. I'm worried they're going to take away my driver's license and things like that. And I can't face it. Well, then do some of the stuff earlier on and improve your snoring and sleep apnea. Because if you drive with obstructive sleep apnea, you're risking yourself, your family members, your wife and kids or whoever. You maybe also run over someone on the street. These are awful things that happen. And people think, well, I'm fine to drive. Don't tell me I'm not, because I'm never tired. I don't fall asleep at the wheel. It's not about tiredness. And I think this is where the DVLA have got this wrong. In fact, it's not tiredness, it's vigilance. And so people with obstructive sleep apnea, even though their Epworth score, which is rubbish, please don't use it, their Epworth score is saying that they're not tired, they still do get into crashes. And I think about 30–40% of all crashes in this country are caused by people with obstructive sleep apnea. They don't think that they're tired, and so they're carrying on driving, but it's their reaction time, their vigilance levels that are being impaired. So if you snore so loud that you can be heard through a closed door, be careful. You may have obstructive sleep apnea. You may be risking yourself, your family, your other people on the street who you may accidentally run over, you crash. The people who with obstructive sleep apnea seem to crash in these big fatal crashes on the motorway because it's a boring drive, a straight line, no turning left and right. They fall asleep at high speed and kill people. So please be careful. Get yourself sorted out. If you just want to use CPAP, if you just want to get treated very quickly because you're worried about losing your license, wearing CPAP for 3 months is normally enough for the DVLA to say, okay, fine, you can drive. And We can work around to help you out. And typically, like our department, if you want a CPAP device, we can give it to you within a week or so. If you're a high risk sort of person, if you're a lorry driver or something like that, and or airline pilot, all those sorts of people, they really can't get on with their work without CPAP or some sort of treatment. We can get you in within a week or so. So there are things out there. Please don't feel like you're left alone and there's nothing you can do. There's so much out there that we can help you with your snoring and sleep apnea. There are people, maybe not quite as mad as I am, who actually love snoring and sleep apnea to help you with your treatment and getting you through this problem. Um, I'm not saying much anymore. No value left. I'm going to stop now. There's loads of stuff on my YouTube channel. Please look at it and help yourself with your snoring and sleep apnea. Be more educated. Take this into your own hands and get your health sorted out. Because I'm going to keep talking. Sorry. Your life expectancy for a man in this country with a snoring obstructive sleep apnea is approximately 58 years old, which is terrifying. It's slightly older for women. There's a big trial done, I think, in a veterans trial that showed that after being diagnosed with obstructive sleep apnea, there was approximately 20-something% chance of death within 5 years, and only 32% of people were still alive after 20 years. So you can see that obstructive sleep apnea is considerably reducing your lifespan. So don't just leave it. Get it sorted out. I will stop now. Thank you very much for watching this video. Bye-bye.